Erectile dysfunction is defined as the recurrent or consistent inability to attain or maintain an erection for a satisfactory sexual experience. Erectile dysfunction is very prevalent in this country. Large epidemiologic studies that have looked at men estimate that it's probably about 50% of all men in this country aged 40 to 70. And other estimates say that over the next 10 years, the overall number of men affected by erectile dysfunction estimated to increase by about 300 million. There are many known risk factors for erectile dysfunction. In the past, it was thought that most of it was psychological, but we now know that probably 85 to 90% is due to an organic cause that we can identify. So the predominant ones would be cardiovascular risk factors such as high blood pressure, diabetes, smoking, obesity, certain medications, either medications given for depression or other psychiatric conditions, as well as medications for blood pressure. We know that erectile dysfunction is a common problem after prostate cancer treatment. What we're also learning is that right after, in the immediate postoperative period, it's very important to enroll in an aggressive penile rehabilitation program in order to sort of set the stage for maintaining penile health. Again, the adage that if you don't use it, you lose it is in a lot of ways true. So, normally we're used to getting erections every day, and if we don't do that, get this normal oxygenated blood into our penises, we have problems. There are some psychological causes of erectile dysfunction, and it typically is sort of a self-fulfilling prophecy in some ways, so that performance anxiety has become an issue. A lot of times patients will have normal erections in the evening, in the morning, suggesting that all the architecture and the hardware is intact, but there may be some underlying psychological conditions. I always tell men, in order to prevent erectile dysfunction, you should live a healthy lifestyle. So anything that's good for your heart is going to be good for your penis. So good diet, exercise will all benefit. There are a lot of great treatment options for erectile dysfunction now. So usually we start with oral medications. These would be the phosphodiesterase inhibitors, and there's certainly ones we're familiar with, Viagra, Levitra, and Cialis, and they all do work very well. If those don't work, we move on to some other options. So the first thing I usually talk to men about is a penile injection therapy. There's also medications that we can put in the tip of the penis and then absorbed in the penis that work very well. There's something called a vacuum erection device. And if none of these work or men aren't satisfied with any of these, there's even surgery we can do to put an inflatable device in the penis. Another very interesting thing about erectile dysfunction that I think all men should know is that it's oftentimes a precursor to other medical problems. So a lot of times erectile dysfunction will be the first thing that men notice, and it can actually precede cardiovascular disease by 3 to 4 years. I think most men probably do not realize that. I think that a lot of men think that things change as they age, and to a large extent that's probably true, but things can happen a little earlier than they need to, and it can be warning signs for other problems that can be averted. And more than that, there's interventions that we can institute that help maintain function.